making a recording. While you have the SAVI Wireless with you, if at any time you feel any symptom that you think may be related to your heart, press either of the symptom buttons. When you press the symptom button, the SAVI Wireless saves your heart's ECG activity that occurred about a minute before you press the button, and then continues to save the ECG for about 30 seconds after the button was pressed. This can be very important because the cardiac event can occur before you feel any symptoms. This means that your physician can see what was happening with your heart before you had the symptom. In addition, the SAVI Wireless has a unique auto capture capability that may also detect ECG abnormalities that you don't feel. This is why it's very important to wear the monitor with the electrode patches whenever possible. There are two methods in which you make a recording. Method 1. Press and release the symptom button in the center of the pendant. This is the recommended method. You will hear a beep and a recording in progress will display on the smartphone. Method 2. Press and release the symptom option on the smartphone using the left soft key button. Both methods will initiate a progress bar on the smartphone screen. When the progress bar is full, the recording is complete. While your ECG recording is taking place, you can input a description of your symptoms into the smartphone's diary. Please note, your symptoms must be entered while the smartphone displays recording in progress. The recommended method is to select your symptom, location, and activity from the provided list. After you initiate the recording of a symptom, you should select Diary with the left soft key. Press the left soft key again to choose Select option. Press the Select button and you will see a full list of symptom choices. Using the arrow keys, you can then select from the list of symptoms. Once you have identified your symptoms, press the Select button. Repeat the same step to choose your location and activity. Then select Save with the left soft key and return to the monitoring display. You also have the option to make a voice recording of your symptom. Select Diary with the left soft key, then select Audio Diary with the right soft key, and follow the directions on the screen. Speak clearly and slowly into the phone.
I was watching television and my started to feel tight as though I would...
When you have finished your voice recording, press Done with the left soft key. Reminder: choosing from the list is recommended and most accurate method of identifying your symptoms, location, and activities. Voice recordings can vary in quality. The smartphone will automatically send the ECG recordings to the Cardiac Monitoring Center via the cellular network. It is not necessary for you to call the CMC to send your recordings. Medicomp's policy prohibits the staff from releasing information to you about the content of your ECG recordings. However, your doctor can go over this information with you. Please note, if any time during the procedure you feel you're having a medical emergency, please contact your local emergency medical services. Normal SAVI Wireless use. The SAVI Wireless is intended for use in all of your daily activities that do not involve being in water. This includes sleep, exercise, and during periods of emotional stress. You can shower or bathe, but first remove the cable from the pendant and then unsnap the wires from your chest electrodes. You can leave the electrodes on your chest, but try to avoid applying water or soap directly to them. If after you shower the electrodes start to peel off, simply replace them with new ones. Here are some suggestions for wearing the monitor while sleeping. Wear the SAVI Wireless pendant on the waistband of your night clothing. Place the monitor beside you with the wires extended as much as possible so that you don't roll over onto the unit. Wear a large button-down shirt with a breast pocket and place the pendant in the pocket. Whichever method works best. Just be sure you can get to the symptom button in the event you experience any symptoms. Be sure to charge the smartphone while you sleep. Charging the smartphone overnight should ensure enough battery power to last an entire day. The charger can be found in your kit. Connect one end of the smartphone, the other to a wall power outlet. You will see a charging indicator on the screen. Once the smartphone is fully charged, disconnect the cable. On-screen indicators. You will notice some indicators across the bottom of the smartphone screen. SPBAT indicates a percentage of the battery remaining on the smartphone. 100% means fully charged. The smartphone will alert you when it needs to be charged. PDBAT includes the percentage of battery remaining in the pendant. You should replace the pendant's AA batteries when the smartphone alerts you to do so. If you see BT, that means the smartphone and the pendant are connected via Bluetooth technology. If you see ECG data flashing or constant, this means the pendant is sending ECG information to the smartphone. It is normal to only see ECG data flashing once in a while. The pendant automatically sends data to the smartphone. Cleaning the SAVI Wireless. If needed, clean the smartphone and pendant with alcohol prep pads or a soft cloth slightly moistened with isopropyl alcohol. Do not submerge the monitors in any liquid. If this does happen, first allow it to air dry. Then, seal it in a plastic bag and contact Medicomp for instructions on returning the unit. Medicomp will also ship you a replacement unit. Returning the SAVI Wireless. Once your procedure is complete, please place all components of the SAVI Wireless kit and place the kit into the prepaid shipping envelope provided. If you have an opportunity, please fill out the patient survey provided. This helps us ensure we are always providing the highest quality service to our patients. Seal the envelope and drop it in any U.S. mailbox.